The Tobacco Free Initiative was started during our freshman year, so about 3.5 years ago, in our community health class when Professor Jennifer Allen encouraged us to come up with some ideas of ways in which we could use public health to make Tufts a healthier campus.
So the policy that we drafted aims to create a campus that is entirely tobacco free. So that being said, there are some gray areas in terms of streets and Tufts properties off campus, but the way that the policy is defined is that if it's any Tufts property, it's tobacco free.
Now we're looking for student input into how this policy could best be implemented and enforced in a way that would fit the Tufts community.
I smoke because I'm too stressed. As an engineering student, smoking kind of helps.
I think people probably smoke at Tufts because they come to Tufts having had this addiction already.
I think a big number of my friends smoke. For the workers on campus, after working such long shifts, it's probably their ability to take a break and to relieve some of the stress that they have to go through. I'm sure there are lots of people on campus who do it socially as well.
We had a lot of concerns regarding how different populations at Tufts would feel, as well as is this policy even really necessary if only a small portion of the Tufts community smoke?
Just to emphasize even more that the tobacco-free policy is not designed to be punitive in any way or to further marginalize any groups. Statistics show that 480,000 people die each year from tobacco, and we don't want the members of our community of all backgrounds to be just a statistic.
People of color and LGBT students have been shown to smoke more when they're in a situation where they're constantly hit with microaggressions or different prejudices.
Just depending on different schools, different regions, people are more inclined to smoke.
I don't know if it's okay to say this, but I think a lot of international students smoke.
And as a gay man, I'm definitely concerned about how the queer community is disproportionately affected by not only with higher rates of smoking, but they are disproportionately affected by the negative impacts of smoking.
And I smell the smoke, I don't like it. I feel like I'm offended by them, to be honest. They can smoke, they can hurt themselves, but they don't have the right to hurt me.
You're just putting them elsewhere. They're just going to have to smoke elsewhere if you don't provide them the resources to help them quit. I can definitely see how that impedes on someone's, pursuit of happiness. If someone wants to smoke, then that should be their option. But at the same time, I'm also kind of biased to where I've worked with students whose lives and families have been terribly impacted by tobacco. So I'm kind of torn on the topic.
We've been working really closely with health services, so with Ian Wong, as well as with Michelle Bowdler to offer cessation resources for students for free, as well as to mirror this project with Marathon Health for the staff and faculty. So that includes products like nicotine replacement therapies, as well as homemade quit kits that would have cinnamon gum and stress balls and things of that nature.
One of the things we talked about was maybe having a time frame to implement it. So instead of this just starting to be a policy next month or next school year, maybe having smaller initiatives that happen over a period of 3 to 4 years, and having it more of a culture shift as opposed to a policy just kind of saying you can't do this.
One of the benefits that we have is that we're a very small campus that's highly integrated into the surrounding community. So getting off campus is not as big of an issue as other schools we've done research on have had. For the average pinpoint location on the Tufts campus, it really doesn't take more than 5 at maximum 10 minutes to get off campus.
It might prevent people from starting to smoke because it takes more effort to go off campus and then start smoking instead of just going downstairs and pulling out a cigarette.
Maybe people do want to smoke and maybe this is how they choose to live, but I think it's also good to know, or it's good to be able to see, initiatives taken to help students see that there are other outlets for stress and things like that.
There is a survey that is going to be released, and one of the things they mentioned that is if there's a lot of feedback that's maybe pushing back on the policy or maybe wanting the policy to be worded a certain way, that is something they'll have to take into account.
This survey has a lot of questions about demographics of the students at Tufts, those who smoke and don't smoke. It has a lot of questions about ways that we can strategize on how to create a healthier campus. And the ultimate goal is to get the most student input possible. So our email address is tobaccofreetufts@gmail.com. So feel free to send us any emails, questions, concerns, and if you'd like to help us out, we would really appreciate that.